This episode discusses topics related to suicidal thoughts, crisis situations, and emotional distress. Viewer discretion is advised. If you or someone you know is struggling, please reach out to a trusted professional or a local helpline for support. Thank you. Hi, everyone, and welcome back to Socially Souled, India's largest psychology community, where we make psychology easy, engaging, and relatable for you. You are watching episode 4 of our series of Counselling and Therapeutic Skills, a complete foundational series where we explore the essential competencies every trainee, counselor, and psychologist must master. Today, we are diving into the most crucial and intense areas of counseling: crisis intervention, with a specific focus on suicidal assessment and stabilization techniques. So, in this class, we are going to be covering three major topics. The first is the crisis intervention. How does it really matter? The second is how to assess suicide risk step by step. And the third is the stabilization techniques that help a person regain back to safety, grounding, and hope. So let's begin with the very basics. Now, as a counselor, first we have to start off with what is crisis. Okay, when we talk about crisis intervention, what does crisis mean over here? So a crisis in any kind of situation is where a person's normal coping mechanisms are overwhelmed. It could be triggered by trauma, loss, relationship conflict, or any kind of mental health relapse as well. Okay, so a crisis intervention is a short term, goal oriented process that helps an individual return to the baseline of functioning and safety. So even if they feel very overwhelmed with any kind of emotions, it is our duty as counselors or psychologists, first of all, to give them, and first of all, to know what and how to behave when a crisis comes in the way. Here, the aim is not to do deep therapy. Rather, it is to stabilize the client, to support the client, and to make the client feel as safe as possible. Okay. So there are key principles for crisis intervention, and that includes, the first one is immediacy. Okay, so how immediately and how quickly we can respond as psychologists when a person is in danger or when they are in distress. Okay, the second is safety, so ensuring both physical and emotional safety that a person may feel, and we as counselors, we have to make them feel as well. The third is stabilization, so helping the person regain back the emotional control that they have lost during the time of distress. The fourth is support, providing empathy and reassurance, constantly making them feel that they have been understood by you and reassuring them. The last one is empowerment, so helping them see that recovery and coping are possible. It is not impossible, and it is not a far-fetched thought that has come now. So, after knowing what crisis intervention is, now let's understand what is the suicide risk assessment. So, suicidal thoughts are one of the most serious crises as a counselor that we face. Okay, so suicide assessment requires both compassion and structure. It's not about predicting suicide. No, it's not about that. It's about understanding the risk and reducing immediate danger. Okay, so for example, if a person, they come to you with the thought only that I don't want to live in this life anymore, it's not about predicting the suicide that, oh, they might do today, tomorrow, oh, abhi bhi ye kar sakta hai. No, we have to reduce. First of all, we have to understand the risks. Risk means that the triggers that it follows. Number two is reducing the immediate danger. Okay, for example, if they are living with those people that will actually dwells them into you know uh just passing from their life, or dying from suicide rather, or any kind of weapon that they have around them, any kind of things that are there around them that will actually make them pro to the idea of losing themselves. Okay, so let's break this down how suicide assessment works step by step. Okay, so the number one thing is to build the rapport and create that safety. Of course, start by creating a safe, non-judgmental environment. That's the most important. I cannot even tell you how important is creating that safe space for a person is by not judging them, being empathetic, making them feel understood, making them feel heard. This is the very basic that you can do as a human as well. Okay, secondly, use a calm tone and open body language. I think we have discussed this earlier as well. It's very, very important. Your goal is to communicate. Okay, so you're not alone in this. So make them feel safe, that they see a very huge reason to do this is that they are feeling alone in this process. They are feeling helpless in this process, and make them feel safe about it so that they can talk more. Once they are going to talk more, they are going to feel that feeling of helpless and feeling of uh, alone or loneliness a lot. So आप जब उनके साथ बात करोगे, so have a better communication, have the body language which is quite open, which is not restricted like this, and rather have a calm tone. Avoid moralizing or reacting with shock, like, oh my god, what is this, why do you want to do this, and oh, this is not right in your life. आपको आपके पेरेंट्स के साथ रहना चाहिए, नहीं आपको अपनी वाइफ के साथ रहना चाहिए. But try to understand that if they're coming with the problem which is related to their family or even friends or with themselves or even with their spouses as well, where are they coming from? Understand that point of view, because morally we will not we cannot use the words you should be doing this, you have to do this, because when we put these kind of words there, you shoulds and haves, that's not right. Okay, because then who are we to morally correct anyone, right? So that's that. So the step number 2 is direct inquiry. Okay, so one of the biggest myth is that not talking about, so talking about suicide actually plants that idea. This is a very big myth that we have. Okay, and we have to break this. In reality, asking directly reduces the risk about open you know about the risk of course passing from suicide or dying by suicide, because it opens the door of honesty, right? So it is very, very important as counselors to be honest with our clients, to openly ask them uncomfortable questions, because वो एक कंफर्ट और बढ़ जाता है. उसको लगता है कि अच्छा, मैं जो बोल रहा हूँ ये समझ रही है, सुन रही है, मैं अनहर्ड नहीं हूं, तो चलो आई कैन टॉक अबाउट दीज इश्यूज एज वेल टू देम. So ask questions. Number 1, have you been thinking about ending your life? Number 1. Number 2, have you ever tried to harm yourself before? Number 3, do you have a plan in mind? Okay. Number 4, do you have access to means like any kind of medication, any kind of sharp objects? Do you live at the top floor? Do you have a balcony, etc., etc.? Do you have access to any of the means? And the last is, what has stopped you from acting on these thoughts so far? Okay, so if they are alive by now, what has been that one, maybe a ray of hope, or maybe a sliver of hope rather, or a silver lining in their life, which has actually stopped them from taking this major steps? Okay, they you should be sounding compassionate rather than aggressive or interrogative during the whole process. So the tone matters over here. How softly are you talking with the person? How with a mellow voice you are talking to them? एंड जितना आपके बॉडी पोस्चर्स, आपके नॉन वर्बल क्यूज मैटर करेंगे, उससे ज्यादा कुछ और नहीं मैटर करेगा. सो इफ यू विल आस्क लाइक दिस, लाइक ओके, व्हाट इज योर प्लान, even if you're asking from a smaller or a softer tone, it doesn't matter if your posture is like this, right? So that actually we have to change that. Step 3 is to assess the level of risk. Okay, so the lower levels of risk maybe here is just thoughts of death, but there is no plan or intent to do that. Number two is support system that is available. So maybe you have your parents, you have your family, you have your friends, you live with your partner, you live with a supportive spouse. And number three is client is future oriented or seeking help. Okay. This is lower risk of suicide. Number two is moderate risk. Okay. They have a vague plan in mind. They don't have an immediate plan, but they have a vague plan in mind. And number two is, of course, limited support. Okay. So it increases a lot of distress. It increases loneliness inside them. That's why you need support. You need people around you just so that your level of stress is also decreased. And the high risk clients here, they have clear plan. They have an intent. They have a mean to do it. They have purpose attempts. They have already attempted before. They are feeling hopeless in life, and they are under any kind of substances as well, any kind of like alcohol or drugs or anything. So when in doubt, always go for these kind of signs that you can see. Okay, so we have lower risk, we have moderate risk, and then we have higher risk. So it's also helpful to explore the protective factors, things that keep the person grounded, such as any kind of pets do they have, any kind of relationships do they have any goal in mind. Okay, do they have any unfinished business that is left, any kind of unfinished plans that there are still left. Okay, so a simple question that you can just put up to the client is, what's something that's still giving you a reason to live, or a reason to hold on to life maybe. Okay, so that actually anchors a lot of hope within the person, and that is exactly what we need over here. Okay. Okay, now step four, documentation and collaboration. So always document what the client said, your observations and your interventions. Intervention is that how are you going to intervene and plan ahead for them, any kind of treatment plan that you have. If the risk is high, don't manage to do it alone. You can contact your supervisors, you can contact your family members, you have psychiatrists, clinical psychologists around you as well, and maybe trauma focused therapists or TFTs who have dealt with similar kind of cases before. So of course you can contact them, and of course emergency services. Okay, always have contacts of emergency services, and ethically, the client safety overrides confidentiality. Okay, where there imminent risk of harm, where there is immediate risk of harm, please, you can cut the confidentiality part and go for the emergency services. Give the clients numbers as well, everything to them, and give of course, the emergency contacts numbers also to the client. But when they say these kind of things, it is usually the lower risk that actually comes with it. All right, now let's go to the techniques that we can use, the crisis stabilization technique. So once the immediate risk is assessed, the next step is of course stabilization. Okay, so helping the person calm down, regain the emotional control, regain the emotional support that they want, and reconnect with with the support system. Okay, so here are some key approaches that you can do. Number one, and very, very extremely helpful, is grounding technique. Okay, for a few of the students who have actually gone through my class as well, we have done this before many times actually, which is known as 5, 4, 3, 2 and 1 technique. Okay, so 5 things that you can see around you, you have to name that, and this is a technique that you can use with any patients who have any kind of an attack, any kind of a panic attack or an anxiety attack. This is a very good technique that you can use with them. So 5 things that you can see, 4 things that you can touch around you, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Okay, so this is actually a grounding technique. This is not therapy. Okay, of course, it's a part of therapy, but it's not like deep therapy. This activates your nervous system. This actually activates your sensory awareness also. It helps you regulate your nervous system from sympathetic nervous system to the parasympathetic nervous system as well. And with higher level of stress, it helps you immediately decrease your stress and anxiety levels. Okay, because all your five senses you are using right now to ground yourself. You are, see, either they will think about the past and then they will and then they will go for a suicide, or they will want to go for it, or they will think about the future, that how my life pans out, and they do not like the future, and that is the main, and that will be the main reason for passing. Okay, so this is very good to keep themselves grounded and in the present moment. Now, number two, controlled breathing. Okay, so guide the client to slow breathe their breathing. So, for example, there is a very famous breathing awareness technique that I usually give it to my client, which is known as box breathing or square breathing. So, inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and hold for 4 seconds. That reduces the hyper arousal, the panic mode, and immediately brings the calmness within the person. Okay, so box breathing is very, very good. You also have 4-7-8. So 4 seconds of inhalation, 7 seconds of hold, and 8 seconds of exhalation. This is very, very good because again, you are not going back and forth from the past to the future. You are very much in the present moment, and then it just helps you to ground yourself then. Okay, now the third one is known as emotional validation. So validation is one of the most powerful stabilizers. So use statements like, okay, it sounds like you have been carrying so much pain inside you, um, and you don't have to go through this alone, because here their mind is all over the place. They have been carrying so much pain. They feel helpless, they feel hopeless, they feel very lonely at this time. So these are very good to go with. Number three is, of course, avoid minimizing or rushing the person to think positive. So even if they are crying, even if they don't feel nice, you don't have to say that, oh, just shove it over, खुश हो जा, नहीं हम कुछ पागलों वाली चीज कर लेते तो तुम खुश हो जाओगे. No, no, no. That's not the way to go about it. Let them have their moment. Be with them. Say these statements like, okay, you are not going through this alone. Um, and I am also there with you right now. Whatever you need, I am there with you. And the last one is validation, that makes them feel heard and not fixed. Okay, they don't need anything fixed, they just need a person to hear them. That's it. Actually, 90% of the problems they get actually solved if you have a person that you can talk to. Okay, so this is very, very good, which is validation. The fourth one is safety planning. A safety plan is a collaborative written list of coping strategies, emergency contacts, and it's like a plan that you're making. Okay, that's a safety plan. It's like a first aid kit that you're making for your client, with your client also. So number one is warning signs that crisis might be building. Okay, any kind of warning signs, any kind of triggers that are there around them. Number two is internal coping strategies. So any kind of journaling, grounding, music, art therapy, which helps them to ground. Number three is social support, which is your family, which is your friends, your therapist, to contact anyone. Okay. And of course, the last one is the emergency contact resources, the helpline numbers, the hospitals, the doctors available, which are on call doctors. Of course, why not call them? And the last is mobilizing the support system. Okay, encourage the client to stay connected. Isolation increases the risk, as we have already discussed. The lower, moderate, and the high risk. The highest risk is of a person who is absolutely lonely. Okay, so we do not want that. We want them to have a better support system so that they are all together, and whatever they are feeling, they can actually talk to anyone, even if they are not your family members. They can be your friends, it can be your spouses, it can be one friend, that one sliver of hope also, that's also fine, honestly. But do not encourage them to be lonely at this time. No. Okay, so with, of course, their permission, involve trusted individual who can help them through this problem. And remember, counseling is not done in isolation. Okay, it's a collaborative system to save lives here. That's why I always say this to my future psychologists, the budding psychologists, that we are actually do not demean yourself that, oh, you are not doctors, you're not saving lives. You are saving lives. Please remember, if they are doing it through physical health, you are doing it through mental health, giving them validation, giving them the support that they need. And this is all what the 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 clients want. They want to feel heard. They don't want to feel fixed. They want to feel heard. They want to feel better, positive, someone that they can trust, they can talk to, they can feel understood by, you know. So that, so I hope you understood what I'm trying to say here. And crisis work can be emotionally very intense. Okay, so always debrief the client whenever there is a difficult session, when you have to talk to your client. Please maintain supervision, check in with your own emotional well-being. How, like, if you can't pour from any, like, you can't pour from an empty cup, right? It's absolutely empty. How will you pour? So you have to be stable, safe, secured from within. You have to have that kind of a mental health so that you can give something to the client also, and plan a difficult session if there is any. Okay, so yeah, all right. Thank you so much for joining today's class on crisis intervention and suicide assessment and stabilization techniques. Remember, you are not always, you should not have like the perfect words. Like, being calm, compassionate, present can make a difference, you know, from the hopelessness to having maybe just a sliver of hope. That's all what you want. And if you found this video helpful, don't forget to like, share, subscribe to Socially Sold, and tap to the notification bell, as I hope that you should be the first one to know whenever our next class is live. Because in the next episode of the Counseling and Therapeutic Skills, a complete foundational series that we have come up with, we are moving to a topic which is very that has to be deeply understood, that are the ethics in counseling, where we are exploring the boundaries, the dual relationship, the therapeutic alliance, informed consent in a therapeutic work. So yeah, see you all in the next class.